As schools throughout the area wrestle with decisions about reopening, we're turning our attention again to COVID's impact on children. How vulnerable are they? How much do they spread the virus? Our Melissa Russo was first to report on that severe inflammatory sickness and now brings us up to speed.
I felt like I wasn't going to make it.
11-year-old Alana is grateful to be alive. While COVID-19 tends to spare most children, Alana was critically ill, first with the virus itself.
She ended up coughing up blood.
Then Alana also developed MIS-C, that rare overactive immune response that impacts some children after they've had COVID.
She was one of the sickest patients that we took care of at Hackensack.
Catherine Klauser was Alana's doctor.
So you can imagine being 11 years old in a hospital all alone.
Alana's mom was sick too. They suffered in separate units of Hackensack University Medical Center.
It was kind of like watching my mini go through the same thing. When she was on a ventilator, I saw her on video chat. It's really hard as a mom to see your child like that.
According to the CDC, children under 18 make up just 7% of U.S. COVID cases and less than 1/4% of COVID-related deaths.
Children are infected much less often than adults. Children are 4 to 5 times less likely to spread COVID.
The notion that children were mostly unharmed by COVID-19 was turned upside down 3 months ago when cases of the rare MIS-C peaked, filling pediatric ICUs with children in shock and cardiac arrest.
When the kids first started coming in, we didn't even have a name for what we were seeing, nor did we really know the scope.
But today we know those MIS-C cases are also relatively rare. New York State has reported 245 cases, New Jersey 54, with the number of new cases almost non-existent.
Now we're down to essentially zero.
Doctors say while most children seem to have recovered fully, it's not certain if they're out of the woods.
It's hard for us to know that someone isn't going to be all better in 6 months because it hasn't been 6 months.
Pediatricians are now keeping an eye on potential long-term impacts on the brain after new data shows children with MIS-C suffered strokes and seizures.
I'm starting to slow down on headaches.
After everything Alana went through, it's easy to understand why her family thinks schools should slow down on reopening.
I feel like kids should not be in school right now.
Though an increasing number of doctors say if the risk of transmission can be managed in hospitals filled with sick adult patients.
We don't close schools for other infections that cause a similar rate of illness in kids. We saw a much more severe course in children of influenza this prior year than we actually did see of COVID.
Hey.
Alana is back at home now. She says she's 90% better and happy that she can finally keep up with Bella, her quick little pet Yorkie, who's keeping her motivated.
I'm getting there.
Melissa Russo, News 4.